Welcome to this special Best of ECTRIMS short video. I'm John Strum, and just a few weeks ago, I was in Copenhagen, Denmark, attending ECTRIMS, the largest MS research conference in the world. For the past 30 years, researchers, clinicians, patients, and their care partners have described MS using the very familiar course descriptors, relapsing remitting, secondary progressive, and primary progressive. Course descriptors that were originally developed by Dr. Fred Lublin and his colleagues. At ECTRIMS, Dr. Lublin gave a presentation on the need to update the way we think about and talk about multiple sclerosis by once again updating those clinical course descriptors. In a moment, you'll see and hear the conversation that I had with Dr. Lublin following that presentation. Then you'll hear my conversation with Tiffany, someone who lives with MS, and you'll see and hear Tiffany's reaction to Dr. Lublin's presentation. This video presentation was made possible through a generous grant from Sanofi. Dr. Fred Lublin is the Saunders Family Professor of Neurology at the Icahn School of Medicine at Mount Sinai and the Director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis at Mount Sinai. Dr. Lublin participated in the development of the very first disease-modifying therapy that was approved for MS. And when we talk about relapsing MS, secondary progressive MS, or primary progressive, we're using the clinical course descriptions of MS that were developed and subsequently updated by Dr. Lublin and his colleagues. Earlier today, Dr. Lublin gave a presentation on the need to update the way we think about, talk about multiple sclerosis by once again updating those clinical course descriptors. Dr. Lublin, what's driving the need to update the MS course descriptors?
So as time proceeds, we have to meet different needs. And so the clinical course descriptors that we had been using for the last almost 30 years have served us well, but it's time to relook at them and think about MS in a less categorical way and more as a spectrum. And that allows us to think about people going back and forth to different phases of the illness so that we could theoretically pick a specific phase that they're in and target our therapies for that phase. So the idea is more targeted therapy, which would be more individualized and potentially less invasive.
You know, we've also read a lot about PIRA, or progression independent of relapse activity. This means that people with MS may experience worsening even without experiencing that relapse. When you think about MS as a spectrum and then consider this concept of progression independent of relapse activity, do those course descriptors like relapsing remitting or secondary progressive MS seem as valid today?
Well, in part. So PIRA, pure PIRA, that never changes, is progressive disease. Primary progressive, secondary progressive. And PIRA is very much dependent on how you define it. So it is not one entity, it's an entity depending on definition. But one of the things that we're seeing now is this idea of progressing without a relapse, but then it stops and gets better. So we're calling that reversible PIRA. And I don't know what the biology is underlying that. It's something new that we've never thought about before, but now is coming to the forefront. And it'll also become a potential therapeutic target.
So what aspects of MS have to be reflected in updated course descriptors?
A more dynamic approach to look at people, when they're having relapses, when they're getting worse, perhaps progressing in a PIRA-type sense, when they're stable, and then ultimately we want to have biological underpinnings for this so that in the future we'll be able to look at someone's genetic makeup and their environmental exposures and their family history and their Epstein-Barr status and figure out risk factors for them moving into the disease. And then also risk factors including potential genes for who's destined to have worse disease. Because we know that all along the course of MS, the earlier we treat, the better people do. And as you heard during this session, you could look even earlier and earlier, and that's the whole idea of looking at things like the prodrome and early changes that lead to MS, because if we treat then, we should have better outcomes.
This really all opens the door to a precision medicine approach to treating MS.
Very much so.
So, developing updated course descriptors will affect a fairly long list of stakeholders, including patients, clinicians, researchers, payers that include private insurance companies and, in many other countries, governmental healthcare systems, and regulators like the FDA and EMA. That feels like a heavy lift. How does it all happen?
It is a heavy lift. The major mechanism is education. Just like we're going to do with the new McDonald criteria that were unveiled yesterday, which are much more complicated than what we had. It's education, and we know how to do this, and we have the means. There's some people who take a little longer to change. Regulators are getting very comfortable with our current descriptors, so we'll have to show them data, which is fine, on why the change is going to affect clinical trials. And then payers are even tougher, because in general they're less science and more dollar directed. And so that will be a challenge as well, but ultimately when we get the data out there and the papers and we present that data to them, we can get beyond their resistance.
Well, Dr. Lublin, I want to thank you for all you do to improve the lives of people who are living with MS. Thanks so much for talking with me today.
Happy to do it. Happy to see you guys here.
We've just watched my conversation at ECTRIMS with Dr. Fred Lublin, and joining me to provide some perspective from someone who's living with MS is Tiffany. Thanks for joining me today, Tiffany.
You're welcome.
When were you diagnosed with MS? And were you diagnosed with relapsing remitting, secondary progressive, or primary progressive MS?
I was diagnosed, by the grace of God, I had a few different symptoms that just did not seem right. So I was able to get diagnosed fairly quickly with relapsing remitting in August of 2021.
And how was relapsing remitting MS explained to you? What did that mean?
Honestly, I'm going to say I did not know what type I had. I was just told that I had MS. And I actually had to ask my neurologist probably a year ago, which one of these do I have? Because we came up with a treatment process and I felt like we had a handle on it, but nothing was explained to me in terms of, hey, these are the different types. These are the symptoms of each and what to expect with each. And then this is what you have. So honestly, I felt really uneducated, nobody's fault at all. I could have definitely asked those questions, but my priority was getting the treatment in place, and I didn't even think about qualifying the different types of it.
Okay, and then when you did get around to asking that question last year, what's your understanding of relapsing remitting MS? What does that mean to you?
It seems to me like it's the less severe path to be on in the world of MS. Honestly, it sounds like something that sort of comes and goes. It sounds like it's something that as long as I have the right treatment option, it's not quite as bad. It's not quite as debilitating. I've been lucky that I caught it so early. I didn't really have much damage to the myelin and the tissue and everything. That's my understanding. Again, I feel like I could probably be more educated on what exactly it means. But from my understanding, it's something that comes and goes. Good times, bad times, good days, bad days. And it's not something that's going to totally knock me down completely 100%, but it's something that I need to keep a handle on.
Dr. Lublin actually led the work in developing the terms we've been using to describe MS for the past 30 plus years. And now, as we just heard, he's part of a group of experts who are working on updating those terms. Have any thoughts about that?
I think it's fabulous. I think it's a way to not generalize the treatment, but specialize the treatment. And I think that's only a good thing. So maybe if this is a disease that ebbs and flows, if we can ebb and flow the treatment, I think that only good things come out of that. I don't see any problem with that. I'm totally on board with hearing more about it, and I'm excited about it. It's not just a blanket treatment. It's something that actually is targeted. And like he said in the video, less invasive potentially.
We heard Dr. Lublin describe MS as occurring along a spectrum.
I think it's a great way to describe it, because lumping everyone into a bucket of that person has MS or even relapsing remitting MS. Everybody I talk to that has the same type of MS I have is having different experiences, right? I have a nephew who has autism and he's in the same boat that he's not identical to anyone else that has autism. And I feel like it's the same with MS, where if we can look at it like it's on a spectrum, I believe that's totally the right way to look at it because it's not identical for even two individuals, much less an entire population.
The new course descriptors will be focused on trying to describe the biological mechanisms that are actually taking place within an individual's central nervous system. Now, researchers have learned that some of these processes are ongoing even when you aren't experiencing a relapse. What do you think about that?
I think that's fascinating. I think that it is true. I went through the Living with MS class that the Shepherd Center put on and learned so much about what exactly is happening, what's probably specifically happening with me in terms of the myelin, the nervous system channel essentially getting destroyed here and there. And it makes total sense. I'm an engineer, so I need the details and I need things like as technical as possible. And I love that. I love knowing that this explaining more about what exactly is happening. I okay, so I have a lesion on my brain, and then the traffic from the brain to the muscle is interrupted, and then that's why my foot flops. Understanding that is a little bit less scary, and it's more manageable to me mentally than, okay, I have something that's in my brain that I can't describe and I can't picture. So I love, like I said, I'm an engineer, so I love that technical aspect of it.
Obviously, there's a lot more work that's going to take place in this process of developing new course descriptors that more fully reflect the progress that's been made over the past 3 decades in understanding and describing MS. Tiffany, I want to thank you for sharing your thoughts with me today.
Thank you very much. Nice to talk to you.